Hey all, we're going to chat a little bit here about the importance of different radiographic projections for the diagnosis of lower urinary tract disease in dogs. So this is an example of a young dog that has some cystoliths present. This is an intact male dog, so we can see a little bit of prostatomegaly as well in this patient. We can see that he's intact even radiographically. And what I really want to highlight here is the importance of having a flexed leg projection that highlights the perineum. So what we're really concerned about, especially in male dogs, is whether or not there are any stones within the plane of the urethra. And what we can see here is that there is a little mineral opacity that if you look very closely, you can identify superimposed with the femur here. But when we look at this patient in the flex leg projection, we can actually see that there are separate small calculi that have gotten stuck at the level of the base of the os penis there. And so this is a really important projection to be able to identify the presence of those stones. Our ventrodorsal projections can also sometimes be helpful, where we can see there is just a little bit of separate mineral foci there at the base of the os penis again. And the other things we want to look for when we have patients with cystic calculi, presence of nephroliths or presence of urethroliths, and we don't have evidence of that in this instance. We do have these focal soft tissue opacities that sometimes get misidentified as urethroliths, and these are end-on vessels in the retroperitoneal space there, so we shouldn't confuse this for an actual urethrolith. Other things to note in this patient is some chronic degenerative intervertebral disc disease. There's collapse of this intervertebral disc space, spondylosis deformans, and some mineral opacity extending dorsally as well. We can see in the ventrodorsal projection that there's some lateral component to that spondylosis deformans, which could be part of what we see ventrally here in the vertebral canal or superimposing the vertebral canal. So this is probably incidental for this patient and not why they've presented. So the real importance here is just noting the difference between this flex leg lateral, where we can really highlight the urethra, and this normal lateral projection where we cannot. So really highlights the importance of doing this view in any dog, especially male dogs, where we're concerned about cystolithiasis or we're concerned about lower urinary tract disease. That's about it, and I hope this helps.